Welcome to a quick look through some of the opportunistic organisms with HIV. And here we go. The history. At the beginning it's usually thrush. It goes on to more weird diseases, some wacko type of fungi and viruses and a mycobacterium. Prophylaxis, this is FYI here. Prophylaxis, they usually start in with when it hits less than 200 cells of the CD4 count per cubic millimeter. And this is FYI. It shows you the longer it goes, the lower these goes CD4 count, the more vicious come the infections. First one, PCP. It could be a protozoa or a fungus. They're still trying to battle out what it is, but nobody knows. However, it causes severe disease. And when the CD4 count gets really low is when this can go on. And then the treatment, well, first diagnosis is with the bronchoscopy with a BAL, bronchoalveolar lavage. You'll see that a lot. BAL, washes out the lungs, they check it out, and can diagnose it. Treatment or prophylaxis. Prophylaxis for this would be Bactrim. If somebody can't tolerate Bactrim, they go to Dapsone. Now, Bactrim, TMP, trimethoprim sulfamethoxazole. Very important. DS or single strand. Single is rare. PCP, TMP, PCP, SMZ. However, this is critical to remember. Bactrim. So now the sulfa drugs are used not only for nocardia, as we discussed. Now you see here it is. It's a landmark for PCP. Very important. Next is toxoplasma, protozoan. You swallow it, you breathe it in. It's part of the atmosphere. When you've had cat litter boxes, you throw it out, you inhale it. It comes from certain undercooked foods, and it gets into the brain, and the cysts get in the brain, and you can diagnose it sometimes by having the patient hold their hands out and check their motor function, and you can see their hands are just wagging slightly all over the place. It's a horrible sight. And on the CT, there's the little ring. It looks like a ring with a bright light around it, ring-enhancing lesion, and it's caused by it's living in the brain. They can do a biopsy and check it out too. So the prophylaxis is, again, Bactrim for toxo. However, more common thing for treatment, once it's been diagnosed, sulfadiazine, very fat-soluble sulfa drug, gets into the brain. Pyrimethamine is a folate antagonist, blocks the folate system in the bug and the pathogen. And leucovorin recovers the patient's folic acid on afterwards to bring folic acid back into the body so they don't get anemia. Bottom line, toxo, TMZ, Bactrim, primary, secondary is listed here. Anybody who's allergic to sulfa, true allergy, they go to clindamycin to kill the protozoa. MAC, avium, means birds, so as they fly over, you inhale their waste and it gets into your lungs. The wind blows it from the ground, you inhale it. Many people have it, but we don't get it unless you actually have an compromised immune system. So it comes from birds, Mycobacterium avium, and sometimes it's called intracellular. So some texts have MAIC or MIAC, Mycobacterium avium intracellular complex, and some books call it MAI. And you have to be able to test it and differentiate between TB because they are both Mycobacterium. The first choice for prophylaxing, the patient has a low CD4 count, would be Zithromax, 2 of the 600 milligram tablets once a week. The clarithromycin, you'd have to take it too often. Now, there are other multiple treatments later on. If it's actual treatment, this is primary prophylaxis. Other opportunistics. Now, these go back to the ABX1. Now, in ABX1, we talked about diflucan, and this is fluconazole, and then there's voriconazole and itraconazole. These are they kill yeasts internally. So Candida albicans, a yeast-like fungus that multiplies it by budding. It's white throat. You can see white all the way down into the back of the pharynx. And diflucan is prophylaxis as well as treatment. Remember that. Whatever was on the original MBX1 that applies to OIs, it applies to this exam. Herpes simplex, Zovirex, remember they had your acyclovir, valcyclovir, you had your famciclovir, then CMV, retinitis, or also in the gut and other parts of the body, anus, esophagus. So cytomegalovirus attacks all over. There's ganciclovir and valganciclovir. For tuberculosis, there are multiple medications because you can't use one or two because of resistance. So the multiple meds include rifampin and isoniazid. Remember INH, anytime you give that, you must give vitamin B6 too to prevent neuropathy. That's very critical to know. And then there's antiambutal and many others. So in 6 minutes, there's your snippet. Lots of luck, and